already signed.
Yeah.
Give it just a minute before we start. Dr. Martini squeals in on two wheels about 5 o'clock on the dot, so
I think I just saw her plan.
did you see her? See if I can find something before
He's Sanders now.
she
He's
gets in here.
doing better. He still has just some weakness to work through and all that, but, yeah. Yeah, so now it's just a matter of getting his strength building. I hate that person.
Pass that sign-in sheet back
Just
again.
time.
Instead of doing it in orderly fashion, we just keep passing it back and forth.
Okay.
I think that's all we're gonna have, so we'll go ahead and call the meeting to order. 5:01. We will not do the roll call. Mr. Ketchum's the only one that's not present. He's living it up in Tennessee this week, so kudos to him. I forgot to tell him that we're live streamed, so he could have dialed in and at least watched us. Maybe he is watching. So, regarding that, reminder to everybody that we are streaming, so I don't think that really affects us in any way. We don't do anything crazy or off the wall anyway, so. First thing then on the agenda is approval of April meeting minutes. The April meeting was, executive meeting. Good grief, I can't remember the brain wasn't working. So we don't have any minutes to approve. We just have a sheet that says personnel matters is all that we discussed. So when that comes around, if you'll be so inclined to autograph that. The next thing on the agenda is a health officer's report. So Dr. Welsh.
Thank you. It's been a busy time. Talking with WRBI each month, a lot of information a week or so ago having to do with fireworks safety and food safety, especially with the 4th of July cookouts. It was interesting bits of trivia that the last 3 years, the injuries and deaths related to fireworks has been steadily going up. Last year, there was nearly 15,000 serious injuries from fireworks in the United States. I thought that was particularly interesting. I didn't hear of any major catastrophes when it came to the 4th of July cookouts, but those may trickle in. I didn't hear any work coming from the ER. I don't know if Dr. Martini did either. Earlier today, there was there's a webinar, regular thing each month having to do, it's called ECHO, has to do with public health things. And today's presentation has to do with ASPR, which is involved with disaster management or disaster response. And today they were talking about serious infectious disease issues. Apparently, there is a unit, looks like about the size of on the back on a semi-trailer, and it's transported via a military Hercules aircraft. And it is a self-contained unit to handle folks with deadly contaminated infectious disease like Ebola and things like that. So if they don't have the proper facilities like at a hospital, they can send this unit to different areas of the country and respond to outbreaks. But it was a really good presentation. One of the things I wanted to bring up, and I've talked to Tara before, is a year ago there was a nice presentation from IDOH having to do with what do you do if there's a radiation exposure. This was something that came out after the New Palestine train wreck in Ohio, and there is a specialist at IDOH who will speak, and her come to communities and speak. She has things geared, it can be geared towards like hospital personnel, EMS personnel, or general public. And I thought this would be a nice subject to try to bring up and maybe invite some of our neighboring counties, health departments, EMS, hospital personnel to hear her speak. And that's something that we're going to be putting on the agenda. Now that also since our last meeting, I had a blast at Muscatatuck. So with my work on the Trauma Commission, one of the committees that I chair has to do with disaster response and military integration. And because of that work, I got invited to a session of training for urban search and rescue at Muscatatuck. And if you've not been there, the setup there is incredible. And apparently it is used for all sorts of training. They've got basically collapsed buildings, collapsed parking garages, there's an old school there, there's different structures. They actually have a town built in a pond so that they can practice, people can practice water rescues. 101st Airborne's been there, 82nd Airborne's been there, SEAL teams have been there. Apparently, if you're doing something there and one of these other elite groups, and there's groups from all over the world that train there, and it's under the auspices of the Department of Defense, so they're very, very strict at the gate, I'll just put it that way. But if you're doing something over here at this class building, and the SEAL team's working over here, and you're told stay in your space, stay in your building, do not leave, or you would get caught up in the other operation. And I guess that's happened before to them. It was a really great experience. I got invited, and of course, I think there's some folks that thought I would just like observe, and I came prepared with boots and clothes that were appropriate, and got it to climb under the rubble and help them bring people out. And I can pass this around. This is patch from one of the Army units, and this is actually one of the really neat. Some of the trainers were from the Israeli Defense Force, and this is their battalion. So I just wanted to share that with you. It was 2 days. It was raining intermittently. It was hot and muggy, and it was interesting to watch how they treated each other. Really a team effort, and there were some folks who got pretty sick from the heat, but they made sure that they got appropriate care. And while we're doing our thing in the collapsed buildings, there's Black Hawk helicopters taking off and landing over in the other field. So it was really a great experience, and we may be able to do something in the future with some of our local EMS and future efforts. There's another similar session in August that I may try to sneak my way in the door, since I know how to get in there now. But it was really good, and I did want this group to know that while the State House does their budget every other year, there is a little used opportunity on the non-budget year to submit a change in the budget if the economy does much better than the forecasters had said earlier this year. So, and with that in mind, I'm going to present a resolution to the Indiana State Medical Association to ask them with their legislative folks that when the economy gets better, that the ISMA work with other stakeholders to have the budget for the Health First Indiana be reconsidered, see if some of that, see if we can claw back some of the 70% that was decreased for the next 2 years. Just wanted to let you know that was on the radar. Also wanted, since we're in a public meeting, wanted to make sure folks knew that, we have a long history of safety with vaccines. And I actually saw a webcast earlier today that isn't, the vaccines we're using go back, some of them back to the 50s. So we have decades and decades showing safety. The health department will continue with the same recommendation of the schedule for the vaccines. If people have questions, I would encourage you to talk to your child's pediatrician or your family doctor, and they can have that discussion with individual folks as to what was best for them. Also, we're really good about kids getting vaccines. We're not always as good about adults. So we're a rural community, so one of the things I just wanted to put on people's radar is ask yourself, when was the last time you had your tetanus booster updated? And if you're an adult, if you can't remember it, you're probably due. So I would encourage folks to do that. And I mentioned, speaking of WRBI, one of the things we talked about was summer heat and food. So please be thinking about pets, making sure they have plenty of water. I know the farmers generally take really good care of their farm animals, so don't have to encourage them, but please look after your senior neighbors, and please look after animals in your neighborhoods that maybe they're not getting enough water, maybe it's too hot, but just to keep an eye out for safety for our senior neighbors and pets, either your own pets or your neighbor's pets. Is this time of year, when it's really hot or really cold is when they can run into trouble. But I'll stop there and see if anybody has any questions. Yes, ma'am.
I just wanted to add to one of your comments. So Alicia actually noticed that the health department, or that Ripley County had no cooling centers listed on 211, and she brought that to my attention, and we've gotten so far 3 different locations to step up and have their business or location, some of them libraries, listed as cooling centers. So
That's great.
kudos to Alicia for
That is great.
noticing that.
Any questions for Dr. Wells? Should have not had to sit down, Tara, because you're back up again. Up, down, okay. Administrators.
Tara Briggs, Health Department Administrator. So I've passed out kind of just what, and I have added to it since then, but I had invited our commissioners and council to come to the Health Department to do a walkthrough. So they saw some of this, but then I did add to some of the numbers before I emailed it out to you. But it was my goal for them to kind of really get a better understanding of what the health department does. We're not just food and septic, but we do a lot of preventative health care. We do work with the community. And so I wanted to make sure that they understood that and then understood our different funding sources, because I think there was some misconception about that. All 3 commissioners did participate, and I did have 1 council member participate, and the others opted not to. But let's see. So Dr. Welsh already mentioned the HFI cut, so just going forward, what we're not spending this year, I can't spend that savings next year until it's approved. So that happens in the middle of the year. So for next year, I'm really only budgeting next year's allocation and then what we did not spend last year, but it really only covers salaries, and then we can do our 10% savings. So I am trying to make sure that we are not dipping into our capital savings. But all of our operational costs, we're trying to get our operational costs coming out of our reimbursable grants. But I am asking, I did propose the budget for the county, and I did ask that the county step up its support. So I'll have to keep you updated on how that goes.
I have a question about that. So
Yes.
What do you think, what do you see as the timeline for deciding, like, if we have, like, do we have to cut back on services, or do we think we'll get some additional funds?
So that is one of my questions that I was going to propose to you, because right now we don't have a school liaison. So we can provide the schools supplies, but what we're lacking is that educational piece where we're actually going into the schools and providing education. So my question was going to be if I should hire someone on what's left over of the school COAG fund, knowing that that money, there's no more of it. So if I spend it on salary, there won't be, you know, in 2 years, I won't be able to host the back-to-school bash maybe after that. So I did want to make sure that I did have enough money left over for school supplies and like school-related events. But if we're hopeful that there will be more funding in the future, then I could hire a school liaison to do that educational piece out of the school COAG funds. Other than that, I would say the only other service that we would be cutting back is we are doing a lot for these mini grants where the money's passing through us and going into the community on their kind of their own initiatives. So there won't be that we have this year's what we can spend, but next year we're not going to be able to do. We did make a commitment for the mobile integrated health unit, and I'd like to continue that. But for any other mini grants, like for example, we did the vision screening for the Lions Club, things like that. That's where we would have to cut back first. So I do have some numbers there from our different divisions. I don't know if you have any questions about our numbers, but there is still, growth in happening in Ripley County. It does kind of make me kind of look at some of our ordinances. So that's kind of one project that I'm working on, because there are questions that come up that our current local ordinances don't really easily define, and I don't like operating in the gray area. So I'm looking at doing a pool ordinance, maybe updating just some definitions on residential, maybe I know the septic one, I think that got revised recently, if I'm not mistaken. But if we can get ordinances that kind of more clearly explain things like who should have to pay a fee, who should have a fee waiver, should we charge school pools the same fees or not, have fee waivers. So those are all things that I'm working on in between the grants that I'm looking at. But do y'all have any questions about kind of some of the numbers? We did have a groundhog and some bats, and what did Tracy most recently drive? Oh, another bat. So there's been 4 bats and a groundhog so far for rabies checks. The results we got back so far were negative, but there is that risk because of the unvaccinated dog population we have in our county. But we do have a new staff member. I do want to introduce her. I can do that now, or I can kind of wait until the end.
Does anybody have any questions for the report, the handout? I think this is a good, I guess I'm a visual learner, so this is good to look at this in this fashion. I know we've got reports in the past, we've got a bunch of spreadsheets, so we've got a bunch of numbers that.
I was really hoping that I can tell more just a story than just numbers in the future. If you want like comparative numbers to like last year, I tried to do that to show do we have more in this than we had last year, but the numbers are kind of all over the place right now. So if that is something you're interested in the future, like comparing kind of year over year, if you more like the story format, or if you just like spreadsheets.
I think with spreadsheets it's way too easy to cut the numbers that eventually financially don't make any sense.
I like what you did here.
This is a better snapshot, I think.
Okay.
Do it this way. Does everybody have an opinion or agree? Agree and disagree?
I do have some questions about some of our funds. I just wanted to get kind of your opinion on it. I don't know if that, is a votable or not, but, so there's currently, if you look, there are 1, 2, 3, 4, 5, 6, 7, 8. So there's 9 funds that I'm managing. So several of those are funds that there's no more money coming into. So my question for those was, do you want me to spend out of those and have them spent down till they're closed, or would you prefer that I kind of treat them as a savings account? It's just, if it has to be rolled over, that is more work. Or to save maybe like in the HFI column, which the state doesn't like that. They want you to spend it. Or save under the general county. We're trying to make sure we maximize our reimbursable grants. Some of that's a little bit easier to do than other grants, but
So I think you already mentioned it, but the fact that the HFI money is drastically reduced is a concern. I realize that there may be some light at the end of the tunnel. I just hope it's not a train that comes to say, you're not getting more money. We're actually taking away, or we're not doing it in the next biennium.
if you're wondering where I'm at, I'm on page 2, that second on the balance sheet. That's kind of what I'm
Yeah.
looking at.
That being said, and you've already alluded to the fact that there's no more money coming in currently, because we did get some HFI. There's no
Right, there's no more coming into health maintenance, health trust, or the school COVID.
Health Trust, school co-op. So I want to, and I think you did, if I remember, but I want to get, all salaries and benefits in the county general budget.
I did
Get
put,
away completely.
right.
I don't want to lay people off.
I did ask, on the budget, I did propose to move vital records, Missy's position onto 1159. It didn't for the maternal child or our clinic assistant. Those are still under HFI on the new proposal. Is that something you would like me to?
I mean, budgets are already submitted, but, moving forward,
Okay,
if that's something we can do, and that's, again, you're gonna,
yeah.
you
They-
are with our backing going to present that to 7 people sitting up
Okay.
here who are known as the county council that can say yay, nay, whatever, so, I mean, it's a battle that I'm willing to take, because I'm real nervous about funding them in other places that may eventually run dry. And I'm also nervous about funding them now. I mean, it looks good there, we've got money there, and we're able to fund it there, we're saving money in the general budget, but if that goes dry, will they absorb those back into the general budget? I don't know.
I did to kind of cushion the fallout, I did go ahead in my budget and I increased some of the operational costs on the budget for the county, so they didn't get a sticker price shock on next year's budget, trying to ease them into it, but,
And obviously, we're dealing with that, an ease in that transition, that we can't. What I'm saying I want to do is a big jump.
You do?
because
Okay.
There's a lot in HFI now that, yes, I approved a budget before and I looked at it, but in my opinion, probably shouldn't all the eggs shouldn't be in that basket, so.
Okay.
I would, there's some of the HFI that gets carried over, and I think it's better to use that first versus the savings account, if
Okay.
you will.
So you would say the HFI before the health maintenance, health trust,
Right.
et cetera, okay.
Because if they cut it even more,
need it.
You're gonna need that other cushion.
School liaison.
Well, actually, I can update you. There was one lady we had talked to, and she had to back away because her father had serious health concerns, and she didn't follow up because he's had a downturn. But I did ask her to at least connect with you, so I think in the next week or so, if she does not, then we need to figure out what to do with that position.
So would the recommendation be to eliminate the position or to pick it up under the school co-ag fund?
So you can roll, what you're saying is if you don't spend all of these, you can save it for next year, assuming we're gonna have a lot less money.
Correct.
What is your feeling on it?
Well, I used to work in the schools, and I think it's nice to have that relationship, but I also, if we're going to have to cut services, it's easier to cut a service we're already not staffed for and maintain the services of what we already have.
Because if next year we only have 40,000 or whatever, then we won't be able to pay for the things we already have, correct?
We won't be able to do regardless, we're not going to be able to do the mini grants. But we could maybe, with what we don't spend this year, once that rollover is approved, they've never denied a rollover request. If it's approved, we could spend what we haven't spent this year if it's approved. But
So you're thinking maybe drag your feet on hiring a school liaison to see what happens financially, like if we get money rolled over or not?
I would say yes. And it certainly doesn't make sense to hire one now in the summer anyway, because school's not in session, but that rollover, I mean, we would be going a whole school year without a school liaison, because that rollover wouldn't be approved until the summer of next year, so. And by that time, the schools won't be expecting services from us because, that gap's already happened.
Yeah,
We do have,
that sounds
sorry,
good.
we do have HFI rollover from 2024 that's rolled over to this year. And then at the current spending rate, if that makes sense, we will have rollover again to go move to next year. But as she's already alluded to, that won't be approved until later in the year. So just as you're thinking about what you want to do or don't with it.
Just no salaries consume very quickly, so. So we can revisit it then, okay.
But you thought that we'd still be able to offer some.
We can still, I think at this point, we can still fulfill like their supply requests. They request things like lice kits, hygiene products, they, do what? Fidget toys, and then the back-to-school bash that we're doing on Thursday. So if you have kids or grandkids, make sure to come back on Thursday. But we can do that more easily if we're not consuming that in salary. And I'm fine managing those requests, so.
I hate to do more with less and put more back on a
Yeah.
smaller staff, but I think I agree that, if you can manage, I mean, you're doing the back-to-school bash.
Yeah.
Without a school liaison person, so.
We just can't, we won't be doing the educational
you can
part
do it.
is what
We'll
we're
have somebody
missing, yeah.
To devote to educational piece.
And do we have certain educational things that were set up, like Pilates?
Do you remember like what some of the, so they did some vaping, there's a lot of supply stuff back there.
Vaping education, she did the Erica's Lighthouse for the mental health portion. I just know there's a lot of vaping education.
There's a lot of potential out there of things a school liaison could do. So like, for example, where I came from, the the health department gave Stop the Bleed training to all the teachers in the school. They did Narcan training, and then after Narcan training, all the teachers got Narcan for their classrooms, and they got Stop the Bleed kits after the Stop the Bleed training. So there's just a lot of potential out there. If we had a school liaison, we just wouldn't be able to explore some of that. So.
Well, I think we've, through what we've already done before, we started getting HFI money. And what we've strengthened with HFI money is these community partnerships. So you talk about the MIH program, talk about, you know, mini grants or, you know, different people that we now know do things that we maybe didn't know before. So I think community partnerships can help out with some of those shortfalls.
Okay.
I guess is the best way to put it.
I don't know if you're interested in some of the partnerships that we've kind of helped support with our HFI. I'm looking at page 11. So I already mentioned the Lions Club. They got 2 vision screening machines. Like I mentioned, the mobile integrated health unit, we've pledged to continue supporting their salaries and their phone expenses. And then Missy is serving on the suicide and overdose fatality review team, and we've supported that team. Batesville is interested in their school, we supported them on their Heart Saver CPR certification that they want to get for their school district. There's not currently anyone in the 30-day window, but there have been people by 30-day window. So after their application's reviewed and we've kind of agreed to go forward with the funding, then we have to do a 30-day posting. So I've been posting those on the wall of the health department. So there's nobody currently in that review block, but I have received other proposals. We've talked about pools. So there is the pool at the state park is interested in some safety equipment. The other one escapes me right now. So we do have some other people that are still interested in some support from us. I did want to mention our maternal child health coordinator. We're really trying to ramp up her prenatal education. And so for incentives, we're looking at partnering with the thrift shop in Batesville, that if they do X number of prenatal classes, they can get maybe some baby clothes at the thrift shop. So we're looking, that's kind of in a 30-day review window to do like a voucher program for that, for an incentive to do the prenatal classes. I don't know if you have any thoughts on that. I don't know if there's one question, one theme that keeps coming back up is there seems to be public perception that we're spending too much time in Batesville and not other parts of the county. I assure you that's not true. We are doing classes in people's homes or at community centers or other places elsewhere other than Batesville. It's just that a lot of people live in Batesville. So, and then the thrift shop was in Batesville. But we're always looking to explore other ways to provide services to the rest of the county.
You could probably post something about that on Facebook to help with that perception, I guess.
Okay.
You know, if you put, where did this, you don't have to show pictures or whatever, but for,
So any questions? Any more questions, I should say?
Sounds like you're doing a great job.
Thank you. It's a team effort.
You tried to introduce your new hire before.
Oh,
And
my
I ran-
apologies.
And I ran down some other lane, and she's sitting back there patiently waiting for you to talk about her, so.
So
Next
I,
on the agenda.
Pilar, if you will come up here and have the floor, you can talk about yourself a little bit.
Okay, so my name is Pilar Gomez, and I'm originally from Spain. My background is in education, and I'm just thrilled to be working for the Ripley County Health Department, and I feel grateful. I want to take this opportunity to thank my colleagues. They've been amazing. I mean, I felt welcomed and supported, and they've been very patient with my questions and very generous with their time. So I want to thank you, really.
You are. You're a delight, you are.
Oh, thanks.
Do y'all have any questions for her? Do you want to explain your connection to Ripley County?
Well, I live in Milan, Indiana. That's, all right. Well, thank you for having me.
Thank you.
You have anything else for me?
I had
Yes.
a couple questions. One was, is there going to be, when Margaret Mary moves out of county, how is that going to affect, like, public record stuff and,
So
like,
we are
new?
able to print off anything from 2007 to current. So I can print Franklin County, I can print Dearborn County, I can print any county. I can also do that with death. So, because right now I've got our local funeral homes that are here. Instead of them driving to Marion County or wherever, they're actually getting them through me here.
So there's advertising to say, hey, come here.
Yes,
We
there
can sure
there
encourage that
is.
if we need to, yeah.
However, a lot of people they don't understand that if you were born further back, 1950, 1960, even further than, even mine, I was born in 79. My record in Drive is not correct, so I can't print that record in Drive. So if there's an amendment that needs to be done or any kind of adjustments, usually its place of birth is not listed in Drive. Those have to occur in the county in which the child was born in. So anything prior to 2007, I would advise them to go to the county in which they were born in, if that helps any.
Well, I'm just saying, when the hospital moves, all
Well,
those newborns,
We'll still have some home births.
Yeah.
We've got 2 that I'm waiting on right now currently. So,
But we can definitely do social media that if you're still, you can, in current births, you can go to your closest health department or your most
Right.
convenient health department.
and I was gonna say, a lot of them do come here, and the reason why they do is just how friendly our staff is and how we take care of them.
And she gives them the plastic sleeve and the wallet
Yes.
copy, and that is very popular.
Very true. Thank you, Tara.
So do the patients get a packet? They used to get a packet on discharge that had information about different things.
Yes, they do.
Okay,
They get a folder
yeah,
that has on the front, Ripley County, all of the things that we can provide to new parents.
okay,
And then inside is the online application, the in-person application, information about car seats and immunizations.
yeah.
and-
So they should be getting a lot of that information in discharge.
right, but they're going to be in Franklin County
Yeah,
when the hospital
that's
moves.
something that
Right.
they're eventually gonna have to take care of.
Since you brought up the drive and yours wasn't correct, just today from the Attorney General's office, he is stepping into the issue of folks who want to change their birth certificate to a different sex.
Yeah, we're not allowed to issue those come from the state.
That's what and the Attorney General came out publicly today that he will, even though some judges have issued
Yes.
change, blah, 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 his office came out today that he's going to be fighting that.
I was gonna say, we've had several come through our office. And that was when Ashley was still working here. Because her and I helped several people that were like, they cried in our office. So, but yeah.
Just FYI.
I guess the other thing I had, you were talking about going to different communities. We had that brief period of time where there was a vaccine clinic in Sunman. And I didn't know if that was going to be revisited or, I know now there's budget crunch, so I don't know.
Well, we can discuss
Yeah.
clinics. I know the state has come down a couple times and done their clinics kind of in our shopping grounds too, so.
was actually a water boil requirement on my street, but what happened was people got a note in their mailbox. Is that how it normally happens?
So this is one thing I am trying to fight, is that we have, the health department's been kind of cut out of the loop on communication, so I'm trying to make sure we are in the loop on communication, because we are finding out on social media about boil water advisories, and so I'm trying to get ahead of those. But really what we're trying to do is create social media posts. I know some of the water municipalities, they put their posts out on social media, and then I know that EMA had also done some public alerts for that. But trying to get ahead of that, that is something we're,
Okay.
yeah.
And from the hospital's perspective, I would appreciate if you guys were stewards of it, because there's been a lot of times, even though, I mean, I've been in this position for 10 years, and we've tried to set up with, and there's one town that's always after the fact, and it does make a difference. So who would have worked that, would love updates on that.
Okay.
Especially senior people don't always have social media.
Yeah, okay.
Citizens.
Yeah.
The next agenda item is health department staff comments, so you have them.
I was just going to see if
Things to
anybody
say.
wanted to, if anybody wanted to add anything. I wasn't going to make it mandatory for them or anything, but.
Do you guys have any questions for us?
So I want to know, did the bats actually bite someone that were tested, or did they just capture?
The groundhog did, but. Well, that
Groundhog
was-
bit?
That was, yeah, that was.
What?
That was deserved.
One
Oh.
bat was my patient, so I can comment on, but it just flew into his hand, and when they contacted the state department, the Indiana State Department of Health, the email I got was like, people have died if a bat even comes, their teeth are anywhere near, and you may not even know. So it was like very serious, like take this very seriously, wait for the results of if this bat has rabies or not. And if it does, I mean, like, you may want to prophylax even if there's no known bite, because you might not feel a bite. That was the message that I kind of got. So it was kind of like, if it was anywhere near you, the bat, then they wanted it tested. Is that the sentiment? Yeah.
And that's from our infectious disease also, even, because we have a lot of bats and worms in Ripley County, so if you discover one, they still kind of recommend it if you don't capture it.
Yeah.
Too, because they said actually when they bite you, they have this poison that numbs, so you wouldn't even
You
know.
might not even feel it.
The other one was, I'm sorry, the other one was a cat. A cat had got a hold of
A bat?
a bat.
Oh.
Yes.
I'm sorry, how did a groundhog bite? Did they actually actively
We are
try to
being
catch it?
recorded, so.
I mean, did someone try to catch, I mean, that's public awareness. Did someone really try to catch a groundhog?
They did catch the
They did,
groundhog, yes.
they did
It was
acquire it, yes.
out of sympathy, wanting to take care of it.
I'll do the nonverbal.
No comment.
All right.
Another thing that
Oh.
I wanted to update you on the medication drop-off box. People are coming in for death certificates, they're now realizing, hey, I can get rid of my loved one's old medication, I'll be back, great, fine. We just had them collected and we disposed of 59 pounds of medical waste. So just wanted to share.
All right, anything else from y'all? Candy, you don't have like a song and dance presentation, something you want to do?
I do not do either.
Okay.
I did go over to the jail and do some STI testing. Sorry. Well, STD when I was young. Sorry. I did go over there and do that. I'm gonna go back. I don't have a time set yet. But I am gonna go back over.
have any questions for any of them? Cindy, you look like you're deep in thought. Sorry, you look like you were coming up with something.
Yeah, nurses have different thoughts.
Are you offering more MMR vaccinations to adults?
They're available, yes.
Okay.
All right, the next agenda item is actually, it's actually two things that are combined into one that I asked Tara to add to the agenda. So we'll break those out. The first would be health board vacancy. So as we know, we couldn't twist Lynn's arm tight enough, and she is wanted to vacate the board, vacate her position, asked to not be reappointed, and has hung on with us for a few months as we have searched for someone. So this is, and before I move further, she has found someone, brought someone here, and he's here. We'll talk here in just a second. But the statute, I want to run something by all of you. The statute actually, if you remember, last time we reappointed someone, this pesky statute requires us, or I say strongly urges, it requires, but that we provide them with a list of people. 5 people, as a matter of fact, from that list of professions that are in statute, such as physicians, nurses, pharmacists, dentists, social workers, attorneys, veterinarians, engineers, all that stuff. I know in the past we have not taken 5 names to the commissioners. It's been, as you all know, super hard to find 5 names to put on a list to take to them. So with that being said, knowing what that statute says, I don't have a problem. Again, Lynn has found what we believe to be a suitable replacement. Checks the boxes, so to speak, and showed up tonight and hasn't run away yet, so that's a good sign.
I was hoping he was going to be first on the agenda so that he didn't change his mind during the meeting.
So, but yeah, so that, I'm okay with, just taking that one name, has to be, appointed by the county executive, so I have no problem taking that one person, if we agree to that, to the county executive, who met yesterday, so it'd be 2 weeks, but taking that to them for appointment for Lynn's position. They were told, back when she asked to not be reappointed, they were told that vacancy was occurring, and we were trying to find somebody, and so it should not come as a surprise, but that's been 5 months ago, so 6 months ago.
And I do think it's probably been rare that we've ever submitted 5 names. I mean, I'm not too worried, especially trying to fill my vacancy, that they would expect 5 names.
I
I mean, turn us back and say, find 4 more people, and then it'll never be filled, so, I mean, in all honesty, so, or at least not for a very long time, so.
So Joe, you still are willing to serve?
Yes.
Yeah, apparently, yeah.
For anybody that didn't hear, my name is Joseph Miller, and I'm willing to serve. And not to take away from Lynn, Amy is the one that initially reached out to me.
Right.
I reached out to Lynn because Amy told me Lynn was on the board, and the 3 of us kind of talked because I knew them too. So yes, I'm willing to step up and see what this is all about and try and help out the community. I live in Batesville, the Ripley County side, not the Franklin County side.
That's one of the check boxes.
Born and raised there.
Fortunately, we have to do those.
Yep. I am an attorney locally now. I used to have a private practice in Batesville for 10 years. I now work for the Decatur County Prosecutor's Office. I've been there for a little over a year and a half. So that's what I do now is criminal prosecution.
You'll be in good hands with Joe.
nobody has any objection to that, we'll take that to the commissioners. So they will meet 2 weeks from whatever yesterday was. Is that the 21st?
Yes,
Yes.
and it's at 8 a.m.
So, good, yeah, I get to come here at 8 a.m. Bring that to them and ask that they make that appointment. And then you'll be off the hook.
Awesome. Thanks, Joe. Right, this is a lucrative position.
Didn't I explain that to you? Every quarter you get this check, you don't know where it came from, you don't know it. And then you question why they mailed it to you, because the check's barely covers their postage. No, we're not here for money, obviously, but yeah, that's a lucrative thing. It's good ha-ha. The next one is health officer vacancy. So back, I have to look, back months ago.
April.
Was it April? Back.
So we have the executive session.
There it is. So back at the end of April, and then I asked for it to happen, and it was posted on the 6th of May. We posted a anticipated local health officer vacancy, and I think I circulated all that to all of you, and everybody knew that it was on board, on the webpage for the county. That's how the county advertises. I have nothing definitive, nothing, I'm trying to figure out the right adjective. I've circulated by word of mouth different places, but not actively seeking someone. We have had, since that time, I know we had some discussion about possibly a physician that's interested attending the training that's required in, have they figured out yet, September, maybe, probably?
Well, there's 3 different boot camps, north, central, and south. I don't know, they haven't told me the
figured that
dates
out,
yet.
So I don't think it was decided.
No.
And then deciding whether or not they were interested beyond that or from that point, and then making that transition. So that physician has submitted resume in response to this, but it's my understanding that they're kind of feeling it out and seeing what happens and whatnot, so.
And just so the board knows, as of last week, I said I would, was covered with a hospital contract through 25. There, it looks like it would probably be through 26, so we don't have, we have time.
So, with that being said, at the last commissioners meeting, not yesterday, but 2 weeks ago, I was there for something completely unrelated. However, was asked about this vacancy, and was pressed again for something to happen. So, if you're all good with where we're at and what we're doing and how this is progressing, but if not, let me know. Make suggestions. If you want to do it offline after the meeting, we can do that. But just so you know, it was just so know it's addressed in a recorded public meeting. This is where we're at. So, anybody have any questions about that? Nope. None.
Did you want an official vote on maintaining status quo for the time being? Is that, I don't want to direct this since I've already announced I'm off, but
Not till
2 weeks.
you got 2 weeks. You got 2 weeks left.
Should we have a discussion after the meeting,
you'd have to have an executive session.
Yeah, we've not advertised that, so we'd have to
Right.
do that sometime at least 48 hours from now, so.
So the job is still posted, or the position is still posted, and we've only received one resume, is that correct?
It is, correct.
Okay. How long does that position remain posted?
It says official starting date to be determined, and I think that's just the one, that's the only thing in there that talks about starting time. I intended for it to say will remain posted until it's filled, but I don't think it's in here.
So then it'll remain posted until it remains posted, or so long as.
It will
remains
remain posted
so-
until we tell them to take it down.
Right.
That's how long it'll be on there. So. I mean, I won't,
Did they indicate a deadline to you of when we should resolve it?
4 months ago when they didn't reappoint him.
Well, not to get into the weeds with it, but probably maintaining status quo for the time being is where you want to be, because you don't want to force any issue at this point, because being without a health officer is a worse situation than just looking for someone potentially in the future.
Any other questions, input? All right. We'll maintain as we is. Next agenda item is public comments. Joe, you got 2 weeks to be public. You want to say anything?
I'm still listening.
It's absorbing it all in, right? Okay. Dan's hiding back there. Are you, any public comments from you for? All right, they're the only public that's here, so. All right, well, the next meeting then is, what did we decide? October, what did you say, 14th?
14th.
That question was brought up, is that fall break? I graduated my youngest this past spring, so I don't know when fall breaks are anymore, but I'm willing to adjust schedules if there are people that need to do that.
I don't know.
I believe it is fall break for some schools.
Probably.
You can see as it gets closer if anybody has plans. I don't know, like leave it there until, does anybody else have any?
Anybody have a burning desire to schedule it at a different time right now?
I believe Batesville's first weekend is the 11th and 12th, and then that full week is their fall break.
Okay. I'm probably not doing anything, but
I don't know either.
I think for me, it's okay to leave it until it gets closer and see what's happening. I think last year we ended up moving it, like, just because of.
I think it was the week before. We did do the week
Yeah,
before.
because I think it was sectional.
Something was going on, yeah.
Yeah, we had some things that
Yeah.
interfered.
Might be worthwhile to ask Paul Ketchum too, because he.
Yeah, right, you might have plans.
Yeah.
Might be his escape time.
Right.
So. All right, we don't have any, we don't have it specifically on the agenda, but I will open, does anybody have any business that we haven't talked about before we adjourn? No. Everybody shaking their head no? All right, well, then I'll entertain a motion that we adjourn.
So moved.
One last time. One last time.